Welcome to my CPD TV, the home of online medical education in Zimbabwe. Today we are going to be talking about infection control, and specifically we are going to be dealing with issues around isolation and personal protective equipment. So I'm joined today on set by two nurses from Nyanga District Hospital, and with me is Sister Precious Chiringa. Sister Precious Chiringa is the sister in charge for the male ward, and she's also an infection control resource person at the district hospital. And I also have Sister Ronia Chitura, who is also a sister in charge in the maternity department at Nyanga Hospital, and as well an infection control resource person. So I will start with you, Sister Precious Chiringa. We want to discuss infection control because it's a big subject and very important in our hospital settings. So when we talk of isolation, what probably in terms of your experiences, what can you share with us? Maybe let's start with the definition and types of isolation that exist.
Okay, thank you, Dr. Jokiro. Isolation in a healthcare setting, it refers to measures which are observed to prevent spread of infection from patient to patient, patient to healthcare workers or to visitors. And there are different types of isolation which can be observed. There's cohort isolation, there's source isolation, there's protective isolation. In protective isolation, this is whereby we are trying to protect the patient so that he or she won't get infection from other patients, especially those patients who have severe immunocompromised, who are severely immunocompromised, like patients with burns, patients who have undergone surgery like heart surgery, patients who had undergone bone marrow transplant. We also have source isolation. In source isolation, this is whereby a patient poses harm to others. He or she can spread infection to others. Patients like those with typhoid, those with TB, tuberculosis, they can spread infection to others. So we isolate them so that we protect others. We have cohort isolation. Cohort isolation, this is whereby we group patients with same condition, like like for example, in a typhoid outbreak, we can nest them in one unit. And when isolating patients, usually we have to observe if the environment is secure for the patients. You have to consider if there's availability of resources and ventilation, if ventilation is sufficient for the patients.
Okay, thank you, Sister Chiringa, for those insights. Quite interesting. So, Sister Chitura, I'm thinking, suppose I'm working at a clinic, I run a rural youth center, or I'm working in a department like you do, you run a department. Mm-hmm. What sort of considerations or requirements should I observe or follow for me to be able to implement isolation?
Mm-hmm. Okay, thank you, Dr. Jokiro. With isolation, definitely, firstly, we need to know the condition of the patient so that you know about patient placement. It's the first consideration that you should take note of. We have got several units at health facilities. We have got burns units, we have got high infectious bays, we have got surgical bays. So you need to know the condition of the patient first. If the patient is infectious, then you need to place the patient in an infectious ward. And if the condition of the patient is a surgical one, then the patient needs to be nursed in a surgical ward. The room should be enclosed so as to prevent drowse and other infections from the aerosols which can spread through the air. So the room should be enclosed, and as well the patient should have his or her own bathroom, toilet, so as to prevent the spread of infections. As well, we need to consider whether the staff is aware of the condition of the patient. So staff awareness is very necessary as well. You need to train the staff, make them be aware of the condition of the patient, the necessary infection control measures that should be put in place so as to prevent the spread of infection either to the patient or to other patients in the hospital. Then also the issue of linen is very important, considering we've got advanced patients. We need to sterilize the linen so as to prevent infecting these patients with open wounds. So the linen needs to be sterilized. And let's say we have got a very infectious condition in this patient. Linen needs to be placed in a yellow corded plastic bag and sent to the laundry for laundering. And the laundry staff needs to be aware on how to handle this linen when it gets to the laundry. That is the disinfection aspect of it, and they need to have the disinfectant in the laundry department. And they need to launder this linen separate from other linen from the hospital, so as to prevent cross-infection. Then we also have the issue of visitors. It's something that we need to take note of. We know people from home, they need to come visit their relative in hospital, so they need to be told, they need to be taught about the condition of this patient, so that they understand how infectious the condition is, and that they can as well contract the condition. So we need to minimize, we need to limit the number of visitors that get into the hospital. If it is an infectious condition, then no visitor should enter into the room. Then we need to also to consider the issue of waste management. It is a very important issue in healthcare facilities. We don't need just to place waste anywhere. We need to have a bottle pit. We need to have sharps boxes. We need to have working incinerators, so that we make sure that waste is properly disposed. Then the issue of when to discontinue isolation is very important. When the condition is no longer infectious, we can discontinue isolation. Or when the patient is treated, then we can discontinue, clean the unit, and to make it ready for the next patient. Thank you.
All right. Thank you so much. Again, some interesting insights coming in from the thoughts being shared by Sister Chitura. Sister Chiringa, as she was speaking, she mentioned things to do with personal protective equipment. I'm thinking this refers to me as an individual, a health worker working in an environment. Personal protective equipment. What is it really about? And can you share any types or maybe some uses which you know of?
Okay, thank you, Dr. Jokwiro. Personal protective equipment, PPE or clothing, it is done on to prevent a health worker from being contaminated by body fluids or by blood. It can be excretions, it can be urine, it can be vomiters. So it protects the health worker from being contaminated. And there are various types of PPE. Namely, there's headgear to protect the head, like the theater caps are headgear. There are face covers, there are aprons, gowns, there are N95 respirators, gumboots, etc., etc. And PPE, like a surgical face mask, they are there to prevent contamination of the mucous membranes of the nose, of the mouth. And usually, a surgical face mask can come as a surgical face mask with a visor or without a visor. The one with a visor is there to protect the mucous membranes of the eyes. So that's covering the face and of the health worker. And it can also be used by a patient, the surgical face mask, a coughing patient, especially when nursing TB patients or coughing patients, we can give him or her a surgical face mask. There are also some types of PPE like a N95 respirator. It's quite different from a surgical face mask. The properties are quite different. An N95 respirator filters almost 95% of noxious substances and microbes. That's why in a healthcare setting we are using an N95 respirator when nursing TB patients, because it filters all the tuberculobacilli, almost 95% of it.
Okay,
Yes.
to add on to what Sister Chiringa has said, we also have gloves being used as another type of personal protective equipment. And when using gloves, we've got clean gloves and we've got sterile gloves. And gloves are used to protect our hands from contamination with blood products, with any body fluids like she has highlighted. And gloves should be worn before the procedure, and they should be removed soon after the procedure, and hands should be washed. And gloves should never be washed. Maybe people at home in health facilities may think that if you wash gloves, you can reuse them. We should never do that, since they compromise the effectiveness of the gloves. And they protect our hands from contamination by about 70 to 80%. So if you put gloves You should also put measures of infection control as well. Not to say I have put on gloves, so I won't implement other infection control measures. It's very helpful. You have the gloves, then you do other infection control measures so as to protect yourself as a healthcare worker. And also we also have aprons. We have plastic aprons. Plastic aprons are there to protect ourselves, our clothing from splashes like blood, liquor in the healthcare system, vomiters in the healthcare system, and should be used when doing procedures. Should be done before doing a procedure, removed after the procedure, and should be washed. These plastic aprons can be a source of infection as well, and should never be used in between patients. When moving from one patient to the other, it should be changed. And we should never clean the plastic apron with a disinfectant and reuse it. It should be discarded after use, since we've highlighted that it can be a source of infection to other patients. Thank you.
Okay. So, theatre gowns, Sister Chitura.
Yes.
When we go in theatre to do certain sections, we wear theatre gowns.
Yes.
Are they some form of personal protective equipment, or it's just some fancy theatre attire?
No, theatre gowns are a form of personal protective equipment. And like you have highlighted, they are mainly used in theatre and maybe in labor ward. We have also gowns used during conducting a delivery. And as you see, they are usually sterilized. They come in packs, they are sterilized, and they prevent contamination of the patient during the procedure. This is a surgical procedure we are doing, so we should sterilize them to prevent infecting the patient. You put on the gown as a healthcare provider so as to prevent contamination. Our clothes are contaminated as well. They won't be sterile. So with the gown, we are creating a sterile field so as to prevent contamination of the patient during the sterile procedure. So they are a form of personal protective equipment.
Okay.
Yes.
All right. Still, Sister Chitura,
Yes.
on this subject of personal protective equipment, I picked a few examples and lent, the surgical face mask, the N95 respirator mask, the theatre gowns that we were just discussing just now.
Yes.
But at implementation level, are there some rules, are there some principles which guide our use of personal protective equipment?
Definitely, there are rules which guide our use of personal protective equipment. Like we have highlighted, they are used to protect ourselves from blood, body fluids, to getting into direct contact. They can as well protect our eyes, our mucous membranes, and if we have broken or non-intact skin, they can protect our wounds from being contaminated. They protect us from respiratory secretions or excretions. In patients who have got cough, we have got TB, we need to be protected from those things. So there are rules which guide the usage of these things, of personal protective equipment. Firstly, it's hand washing. We should wash our hands before putting on personal protective equipment and after removing personal protective equipment. And like I've highlighted, it should not be used in between patients. Moving from one patient to the next patient with the same pair of gloves, you are simply carrying infection from this patient and spreading it to the next patient. So a personal protective equipment before use should be removed, discarded, or cleaned and disinfected, depending with the type of the personal protective equipment. It can be a source of infection, like I've highlighted. So it should never be used in between patients or extended use of it. Putting on the N95 respirator for the whole week with the same N95 respirator, it can be contaminated and can be a source of infection. So we should never use it that way. Thank you.
All right. Thank you so much. The N95 respirator mask, we keep talking about it. And with the burden of such conditions like MDR TB, which we are now finding even in our own hospitals because of the emergence of high-tech equipment like the gene expert machine, where we are now able to detect resistance to rifampicin. Would you care, Sister Chiringa, to just demonstrate to us how we can effectively make use of the N95 respirator mask?
Okay. Thank you, Dr. Jokwiro. It's true in Zimbabwe we have a burden of tuberculosis and the multi-drug resistant to tuberculosis. So I'm going to demonstrate how to use an N95 respirator. This is a box of N95 respirator and this is the respirator. Usually it comes in various shapes. It can be cup shaped, or it can look like a surgical face mask, yet it's an N95 respirator. So what is important is to see if it is the correct PPE to use when nursing a patient. Usually in a healthcare setting, we use N95 respirator during the nursing of a patients with TB, that is tuberculosis. It can be MTB or XDR TB. Okay, so when donning it, the first thing is to wash your hands. Always observe a meticulous hand hygiene. You can wash your hands using soapy water. You can disinfect your hands using alcohol hand rub. All is fine. Then after that, you let your hands to dry. If it is hand rub, you let your hands to dry again. You hold it, you hold it this way, and make sure you put on your face, covering your nose, your mouth, and the chin like this. The N95 respirator can come in different sizes: small size, medium size, or large. So you have to choose your size. The first thing is to hold this upper strap and put it over your head, and make sure it rests on the crown of your head like this, and it should be above your ears. You also take the lower strip. It has to rest around your neck like this, and make sure it's just below your ears. When you have done so, you have put on an N95 respirator. What's next? You have to make sure it's well secured.
Sorry,
on your nose.
But you said the upper strip should be above your ears, and I think this side is
slightly below
on the ear.
Okay,
yes.
It should be above.
Yes,
thanks for that.
Above, according to your statement.
Okay, yeah,
yes.
It should be above, and the lower it should be below your ears like this. And what you have to do now is to make sure that the N95 respirator is well secured. You use your 4 fingers. Never use one hand, because it might disturb the nasal clip, and it won't function well. So you use both hands like this. You make sure that the nasal clip fits well like this, and if it is like this, I'm now comfortable. So my mouth is covered, the nose is covered, I'm safe. But you have to check if it is working well and if it is fitting well. So you do what we call fit check. There's fit check, there's fit test. In Zimbabwe, we do not do fit test. Usually we do fit check. So I'm going to explain more on how to do the fit check. There's a positive pressure fit check. On positive pressure fit check, this is whereby a health worker have to exhale sharply. If you exhale sharply, if air escapes around the nose, it means you have to adjust to remold the N95 nose clip. If it escapes around the edges of your mouth, it means maybe you have to adjust the strap. Maybe it's too loose or it's too tight, so you have to adjust so that it's comfortable. That's the positive pressure fit check. On the negative pressure fit check, this is whereby you have to inhale sharply. If you inhale sharply, you create a vacuum, and the N95 respirator usually it draws towards your face. And if it draws towards your face, it means it's working correctly. That's what we expect. If it doesn't withdraw to your face, then you have to take it off and redo it again. That's how you do the negative pressure fit check. And usually when putting on an N95 respirator, you have to consider that you don't have facial hair in the beard. It alters the fitness of the N95 respirator. You also have to make sure your respirator, you don't have a problem with the respiratory system, because usually if you have a problem, you face challenges during breathing. And make sure N95 respirator is not used by a patient. It's only for the health worker. Coughing patients should be given surgical face mask, and it can also be used during incineration in the incinerator. They should be trained how to put it on so that they use it during incineration. Now I'm going to demonstrate. I've done my procedure. Maybe I'm nursing an MDR patient, but it is also important to note that you must not put it on in a contagious environment. You have to use an enter room or a changing room to put it on and to put off. So I'm going to demonstrate how to put it off, how to don off the N95 respirator. When donning off the N95 respirator, I'm anticipating that it's contaminated, so you don't have to touch the N95 respirator. What we have to do is to remove, only touching the straps. So it's now vice versa. Now you start with the lower strap, the one which is around your nose, the one which is around your neck. You take off like this, followed by this one, the one on the crown of your head. You hold the straps like this. I'm assuming this is a contaminated N95 respirator. What's next? I have to dispose it off in a foot operated bin, and just after the disposal of the N95 in the foot operated bin, you wash your hands or use alcohol hand rub to disinfect your hands. I think that's all I can say on N95 respirator.
Thank you so much, Sister Chiringa, for that demonstration. But one quick question for you, Sister.
Okay.
Are these things available in our hospitals? Because
Yes.
I don't see many of us or many of our colleagues wearing them. Are these available in our hospitals?
They are available.
So why are we not using them?
Maybe it's knowledge deficit. So when using PPE, we should observe administrative control. On administration control, that's where we are saying we have to use policies, infection control policies. If people are following the policies, the guidelines of infection control, the national guidelines, everything is there, the information is there. And we also have to train our health workers. Every health worker, be ancillary staff, be clinicians, they should be trained. Maybe probably it's because they are not trained. So I recommend training to all health workers so that they know how to use it. Because if they use it wrongly, you remember I said it should be secured. It should be secured and fitting well. So if not, it means maybe you are going to breathe in noxious substances. Yet we are saying it should be well secured and filters noxious substances and the mycobacterium tuberculosis, which we are now talking about nowadays.
Okay.
Mm-hmm.
Well, thank you so much, Sister Chiringa. And so this leaves me to thank you once more for coming on set to share on this subject of infection control. I think we did have a number of issues coming up, and especially the one relating to do with whether we are making full use of resources that are available for us, the issues to do with policies. So I think these are all important subjects. Sure. And I want to thank you once more for making yourselves available all the way from Nyanga to share on this interesting subject of infection control. So there we have it, colleagues. Our discussion, which I was moderating on infection control, and for sure there were a number of subjects that came up, and quite interesting issues, which if we're able to implement in our facilities, I think we'll be able to actually improve the healthcare service that we offer, because this speaks to the heart of our preventive services in terms of prevention of spread of diseases, protecting us ourselves as health workers, and also protecting our patients who may not be having a certain communicable infection, which we are treating a certain patient within our facilities. Thank you so much. So after this, there will be a quiz on the website and a mobile application, which you can be able to complete, and then also claim credit for having taken the lesson. Thank you.